Being a teenager is hard. It may not have been hard for all of you here, but I know for me and for most teens, it was a challenge. And that's because the teenage years, adolescence, aren't just about your body changing, but they're really about figuring out who you are. The developmental psychologists in the world call that identity formation. And they do big research that focuses on racial identity and gender identity and sexual orientation identity. But identity is more than that. It's all of who you are. It's all of the characteristics that you have that make you the person you are. The smart girl, the shy girl, the nerd. But when you're a girl like me, fighting a chronic illness like severe asthma, that also becomes part of your identity. You become the girl with an inhaler, the sick girl. I remember when I was 15 years old, we were living in a low-income housing development projects. I was at home babysitting for my 5-year-old sister and my 3-year-old brother. They were outside playing with other kids under the watchful eye of other neighbors, because that's what neighbors in a community do. And I was in our apartment trying to breathe and not doing a particularly good job of it. I was lucky because my little brother came in to get a drink of water, and he found me on the floor. I was in convulsions. I was barely breathing. And he had the presence of mind to go back outside and get one of the grown-ups who came in, and as the story was told to me later, they called an ambulance, and then there was the trip to the emergency department, and then the stay in the intensive care unit. At some point during that stay, I heard a conversation between a couple of nurses, one of them saying, "That was a really close call. Have we seen her here before?" And another one saying, "Yeah, she's a frequent flyer." And even though I was a little out of it, I knew what that meant. And I knew the judgment behind that term. Because it was a term that was used for people who didn't take care of themselves, who didn't take their medicines, who were a failure at caring for their own health, and who were wasting time and energy that could be spent on other people. They chose to give me that label, to add that to my identity, partially because I did spend a fair amount of time in the emergency department. But you have to wonder whether it was also because of my race, and because of my Medicaid card, and because of my address. But whatever the reason, it was a label that mattered, and it was a label that wasn't associated with great health outcomes. In fact, in reality, for generations, populations in our society, populations that have been placed at risk and made vulnerable due to unfair social and power structures and due to disproportionate exposures to toxic stress and toxic environments, have gotten those labels and worse. Not just frequent flyer, sickly, lazy, weak, helpless, hopeless. And those kinds of labels and terms have allowed people to become comfortable with the disparities that impact the health and well-being of those populations. Populations like the one we're standing in here in the King-Lincoln district. Disparities in infant mortality, disparities in employment, disparities in life expectancy. Luckily, I survived the health challenges of my adolescence and headed off to college, packed my bags and my baggage, and pursued a career. I ended up pursuing a career as an epidemiologist. Epidemiology is the study of the causes and treatments and outcomes of diseases in populations. When I started studying it, I really didn't know what an epidemiologist did. But what I knew was it could help me learn how I could be part of making a difference, making a change. We needed to move away from the treat, release, repeat model that wasn't doing anybody any good. My goal was to figure out how we could help teens develop an optimal health identity, one that was based in empowerment and engagement and not colored by blame and shame. As a researcher, I started off focused on the patient, on the team. I put together a great team of researchers at Nationwide Children's Hospital here in Columbus, Ohio. And we started off by trying to understand, do teens with chronic illness have the skills that they need to take care of their own health? This is a concept that we call health literacy. And it really is about the ability to find and understand and apply health information to make informed decisions about your health. And the results that we found were scary. We found that half of teens with chronic illness didn't have those skills. And it was considerably more than half when you looked at the African American population. And those people who didn't have those skills weren't likely to be able to use the information on a nutrition label or on a medication bottle to make good decisions about their own health. That finding made me wonder, so we've got a lot of kids who need a lot of health information, and a lot of them who don't understand it. Where are they getting the information that they're using to manage their health? So, like any good researcher, we went out and collected data on that. We did interviews, we did focus groups, we asked teens what were their information sources. Some of them said, I asked the doctor. Others said they wouldn't have a clue how to contact a doctor. Some said they asked their parents. Others said their parents don't know any more than they do. Many of them said, I asked Dr. Google. Dr. Google was actually a commonly used phrase. And when we looked back at our data, we saw that that was underlined in what we saw in our results, because most teens were looking for health information online. And when we asked them, so how do you know that what you're finding online is reliable or timely or true? We got a lot of blank stares. A few people had a few ideas, but for the most part, they said, I trust what I find. That finding, the finding that people were trusting things online without evaluating it, that people had limited health literacy when they were looking for these things, that they wanted more help, led us to develop a tool that we're using to help teens become more facile at using health information, both face-to-face communication and online health information. We want teens to be able to develop an identity that starts at competence, that lets them say, I got this. And if I don't, I know how to get it. The nice thing about teens is that most of them don't exist in this world alone. They have parents. And actually, some of my colleagues have said, why are you even bothering with training the teens? Just tell their parents, and they'll take care of it. It's their job. But I would argue that not all parents do that job the same way, and not all parents do it well. Some parents do too much. Helicopter parents. Parents who wouldn't trust little Timmy to call in his own refill until he was at least 30. Parents who do too little. Parents who, overwhelmed with work and other children and just life, expect little Timmy to start calling in his refills as soon as he's old enough to dial a phone. Neither of those are optimal. And within our health systems and within our communities, we need to train parents about what it means to be the parent of a teen with a health issue, about the fact that the transition from being a teen under parents' care to an adult under their own care is a process, and it requires time. We want to get to the point where parents can know that they need to do the right thing at the right time for each child, and get to the point where teens trust and believe that they can rely on the adults in their lives. Because parents matter, because families matter. But beyond that, there's also the community. You know, when I was lying in that hospital bed and listening to that nurse conversation, that nurse didn't know half the story. What she was seeing was only the tip of the iceberg for kids like me who were in that situation. Because she didn't know about the cigarette smoke and the pests in the household that caused asthma attacks. She didn't know about the pollution and the particulates in the community that did the same thing. She didn't know about the uncertainty about whether there'd be money for the next inhaler, and maybe we need to skip a few doses to stretch this one out. She didn't know about the daily stresses, the toxic stresses that just make life hard. In the world of public health, we call these social determinants of health, factors in our communities where we live, work, learn, and play that influence our health outcomes, factors that can and do create health problems and that can make existing health problems even worse. But it's also important to know and to remember that there are factors in our communities that make us better and make us stronger. Right now, I'm standing in a historic school in a historic community. I'm right near an intersection that has a hospital and a library and a hairdresser and a church, all community assets, and a neighborhood that has committed residents and supporters who are trying to expand access to food and to jobs and to entertainment, things that give us relaxation and relieve stress. Because the reality is, children and families exist in communities. And the research we're looking at now says from the earliest days of development, what goes on in those communities matters for the health and development of the child. I think back to coming home from the hospital. I think back to neighbors coming up to me when they saw that I was out and everyone telling me a slightly different story about what happened because according to them, everybody saw it. And in a neighborhood like that, of course, everybody's in everybody's business for better or for worse. I'm going to say for better because I knew that they knew enough to care. And I knew in the coming days when people saw me, they spent an extra minute looking at me, making sure it looked like I was okay. They asked how I was doing. They were a community of support. They were building my health, and we can build stronger teens and families and communities that support health. How can we do this? One way is to improve the way we educate everybody about health, how our health systems do it and how our schools do it. It's time for us to move away from thinking about health education class as anatomy or nutrition, and to really think about it as health preservation class. Teaching people about how to find health information, about how to make good health decisions, about how to navigate our ridiculously complex healthcare and health insurance systems. You might be surprised to know that Ohio, the state that we're in right now, is the only state in this country that does not have health education standards. It's amazing to think about the amount of time and energy we spend talking about proficiency and test scores when we're not willing to commit to creating proficiency in the basic skills to stay alive. It's an opportunity that we need to grasp. And while we're building stronger individuals and families through education, we need to be building stronger communities. A lot of the money that we spend on sick care is better spent on keeping people from getting sick in the first place. You may not think that remodeling houses or starting community gardens or job training programs are health interventions, but they are. Because to the extent that those things build security and safety and self-esteem, those are the foundations of a good health identity. And I say we start with teens. We start with teens because they're in that time of betweenness, between childhood and adulthood, between parent care and self-care, between being who we want them to be and who they choose to be. That's the time when they're developing their identity, and that's the time where we can create the most change. The time that we can get to the point where we help teens to understand that, yes, I have health hurdles. And yes, they may feel insurmountable, but I can be part of creating the best me. I'm Dr. Deena Chisolm, and when I'm being Dr. Deena, I create tools that help teens create the best of them to promote health equity across our community. Thank you.